welcome to my YouTube channel. My name is Alobu and I go by this name on all my social media platforms. On this episode, I'll be talking about the differences between nursing in Germany and Namibia. For those that are new here, I'm a Namibian trained nurse, but currently working and living in Germany. So this video is for nurses that wants to relocate to Germany or for young ones that wants to study nursing in Germany. So the agency that brought me to Germany has these two options: nurses, degree nurses, honors degree nurses that wants to work in Germany, and young ones between the ages of 18 and 24 that wants to come study nursing in Germany. Okay, so I'll first start off with training. So in Namibia, there's three ways how you can become a nurse, right? There's the degree program, the diploma program, and then the certificate program. But in Germany, they only have one program where nurses goes to a vocational training, usually offered by a university, a hospital, so to say, a hospital where they then undergo 3 years training. Like the hospital where I'm working, they have an Ausbildungszentrum where nurses go there, study, and also do their practice at the same hospital. All right. And yeah, so because of the training program, so to say, nurses are kind of restricted in many things. For example, I cannot draw blood, I cannot put up IV lines, I cannot prescribe medication, and a lot of things that I have to do, I have to first check with the doctor, and then the doctor can say yes or no. But in Namibia, it's quite different because we studied a degree, so we are allowed to prescribe medications. For example, if you're working in a clinic, we are allowed to put up IV lines, we are allowed to put up blood transfusions, and catheters as well. In Germany, we're allowed to put catheters, but we have to first check with the doctor. So that's the difference. So when you come to Germany, no. So like I got the shock of my life when we had orientations, and then the project manager said, you cannot put up IV lines. And I was like, but we have been doing those things ever since second year in university. And it's like, I know, but in Germany or in this hospital, you are not allowed to do that. So it might be different. I'm working at a university hospital, so it might be different. Maybe if you end up in a smaller hospital, you're allowed to do that, or if you find yourself in ambulant Pflege, or if you find yourself in a center, I don't know. But currently the hospital where I'm working, I'm restricted in that area. Okay, so what else? So then I would be talking about the uniform. So I don't buy uniform, my employer gives me uniform. So every day before I start my shift, I get uniform, and then when I knock off, I discard it in a container that goes to laundry and is washed, disinfected, and then the next morning I get again a new washed uniform. And I have to have one pair of shoes for work, so I leave my shoes at work. So I don't go with my hospital shoes in the public or home, because we know there's a lot of germs and bacteria in the hospital. Okay. And the other thing, one major difference I would say is the workload. Okay, in Namibia there is enough nurses, and in Germany there is how should I put, not a deficiency but there's a shortage of nurses. So be prepared to have a lot, like a huge workload. So sometimes we are like 2 nurses per shift, and for example, my nurse patient ratio is 10 patients, so I have to do everything for those 10 patients, measure their blood pressure, measure their vital signs, feed them those that need to be fed, wash them, do wound dressing, give them their medications, literally everything. Yeah, but back home you have enrolled nurses, you have RNs, you have a lot of students that are also allowed to do a lot, so you don't really feel the workload. Yeah, and one thing, there's also a difference between the shifts. For example, in Namibia, I think there's 4 shifts, right? AM, PM, night, and 7 to 7. Yeah. And then in Germany, we have 3 shift system. Morning shift starts at 6 o'clock until 2:30. Afternoon shift starts at 1 until 21:30. And then night shift starts at 8:45 until 6:30. Okay, so there are major differences. And the thing is, in Namibia, you can have like a month where you are only working night shift or you are working day shift. But in Germany, you can work all these 3 shifts in 1 week. But the good thing is that we do get paid for this shift. We call it Schichtwechsel. So because we are maybe jumping from morning shift to afternoon shift, and from afternoon shift to evening shift, so we are getting paid for that. Okay. And one thing, the differences also between nursing in Germany and nursing in Namibia is holiday. So in Germany, I qualify for 43 days, that is equals to 8 weeks per year for holiday. Okay, and in Namibia, I believe is 24 days or 30 days, I'm not sure, I think a month. But in Germany, it's like we have 2 months of holiday. So, and every year towards the end of October, we must give in our holiday dates for the next year, because for example, maybe two colleagues or 3 colleagues can take the holiday in 1 month, but not more than that. Because, for example, in my station, we are probably 15 or 18 nurses, and there are those with kids, there are those that are working maybe only 50%, and yeah, so especially the ones with kids, they are priority during summer holidays and Christmas holiday, because during summer maybe their kids are home and they don't have a nanny, so they have to have holidays so they can stay with their kids at home, or maybe travel with their kids. And Christmas, obviously, yeah. And colleagues that are only working 50% or 25% or 70%, 80%, obviously those ones also are working less. So the station leader must organize that there is always nurses at work, so not 3 of us can get holiday in the same month. That's why we have to put in our holidays, and then the station leader and the big chef for the whole internal medicine, they sit and then they discuss, and then they can give you a go, say, you can have your holidays as planned, or can you perhaps be flexible and take this week earlier and the other week. So yeah, that's why we have to give it in every end of October. Okay. And you are also flexible with your holidays. I can, for example, choose to have 2 weeks now in July, and then other 2 weeks in October, 2 weeks in December, 2 weeks in January. So you are flexible with the holidays. And also one major difference, because we work this Schichtwechsel, we also tend to have more days off. I'm talking for myself. Like sometimes I will work 8 days straight and then I have 6 days off. Yeah, so maybe I work 3 morning shifts, 2 morning shifts, 3 afternoon shifts, 4 nights, and then after that I'll probably get 6 days off. Yeah, that's one major difference. And we work like 8 hours, 30 minutes. 30 minutes is your break, and then the 8 hours you're working. And in Namibia, I think if you're working 7 to 7, you have 1 hour break. Yeah. So what else? We don't have matrons, but every station has its own team leader. Every station, a team leader and a deputy team leader. So the team leader is in charge to plan our shifts, to plan, to coordinate our holidays, and What else do they do? Yeah, I think, yeah. So every station has their own leader, not like a matron for maybe labor or a matron for what, but every station has its own leader. Okay, team leader. We don't call them matrons, we call them team leaders. That's on like that. Okay, and yeah, there's differences in nursing as well. Like for example, if I'm working night shift, I have to pack medications for all my patients. Like my 11 patients, I have to pack their medications for the next day. But in Namibia, it's like maybe one nurse has the do medicine round or medication rounds. But in Germany, the night duty nurse must pack medications for the morning, afternoon, and evening shift. Okay, and also the antibiotics. For example, the nurse in night shift, I have to pack the antibiotics for the morning shift. So when the morning shift comes, they only mix with them and administer it to the patients. And yeah, we don't, like in Namibia, we really give a lot of antibiotics via intramuscular injections, but in Germany I didn't even give antibiotics via intramuscular injections, not even once. All the antibiotics I've given either oral or IV, but a lot of antibiotics are given IV. Yes. And yeah, oh, my phone almost fell. So yeah, and I forgot also with the uniforms. In Namibia, we have epaulets, so you can tell the qualification of the nurse looking at their epaulets. For example, registered nurses have purple epaulets, enrolled nurses have blue epaulets. But in Germany, we do not have epaulets. We all wear the same uniform. So I, for example, wear blue calak and white trousers. Yeah, and we all wear the same uniform. It doesn't matter if you are the station leader or what we all wear the same uniform. And students, like the ones that are studying nursing, they wear full white. So the only difference is not is our name tag, our access cards. Then there will be a picture of your face and then your qualification. Yeah, so you could tell, this one is a nurse or this one is a doctor or what when you look at the access cards. Yeah. But in Namibia, there's also those cards, with the name Minister of Health and Social Services, but then we do not have epaulets now. So I think I have covered major differences. Yeah, and one thing, this is a warning. If you're coming to Germany, please, 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 please respect patients' autonomy and dignity. Okay? Yeah, I think this will fit in the patient demographics. Okay? In Germany, we have a lot of older patients in the hospital. In Namibia, we have young patients more in the hospital. So, but the German health demographic is like this. We have more older people than young people. So it means in the hospital setting, we have a lot of older people. And older people needs a lot of help. That's why the work burden is more. Because, for example, sometimes I have 5 patients. Like, let me say my patient nurse ratio is 10 patients. So probably 5 patients, they will need help. Maybe they'll need help with transferring them from the toilet to the bed. Or maybe they'll need help with mobilizing. They'll need help with bathing. They'll need help with maybe applying bread and applying butter and jam to their bread. Or maybe they'll need help, maybe me putting water in a cup. Yeah, or maybe they'll need help with me really giving them their medications. Yeah, so I think that's one major difference, really, the patient's demographics. And sometimes we have a lot of patients with dementia, and sometimes they will be not reckless. They will be restless. Yeah, they want to stand up, although they are really endangering themselves. They will refuse to take their medications. they will refuse to eat and all those things. And I know back home we will be like, please take your medications, do this and that and what. But in Germany we also do say, please take your medications. But if the patient say, no, I do not want, it's not your place to be forcing them. You let them be, because if the patient do something to you, you cannot retaliate. Okay, so you respect the patient's choice, you document it. Okay, and yeah, we also sign a document where we have to protect the patient's confidentiality. Yeah, you cannot just give out any information. Normally, if a patient calls and it's like, yeah, I'm who, I want to ask about who, and you'll be like, I'm the nurse. I can only give you information about how the condition is. But now, what condition? Or like, but I cannot give you diagnosis and all those things. If you want diagnosis, you must call the doctor. Yeah, and be prepared to be answering calls and talking. I'm telling you, with that phone, especially in the morning shift, maybe 20 times people will be calling, oh, from which department? I want to call Master Who to come for maybe bronchoscopy or x-rays and whatnot. So prepare to call to answer those calls, like, yeah, hello, I'm sister. Yeah, hello, what station? Who, how can I help you? So you be prepared to answer the telephone. Although we have a secretary, but sometimes they want to talk to a nurse, and sometimes maybe the secretary is not there, and especially on weekends we don't have a secretary. So yeah, prepared to answer the calls. Yes, and we also have clingers. So like in Germany, every patient has like a button where they can press if they need help from a nurse. Okay, so yeah, that's a major difference there. At home we don't have klingel, so you might be busy here and then the patient klingels and then you have to go if maybe it's an emergency or whatnot. So yeah, and if there's an emergency, you can always press a button and then it will give an alarm, and then doctors and nurses will be running to the room, say, oh, what is wrong, what can we do, and what. Yeah, but yeah, I cannot really compare with technology and all those things, because we all know Germany is a developed country and Namibia we are still developing, so I'll not go in detail with that. But one thing I can say is that one thing I've realized in Germany is that the doctors are really good with diagnosis, like and the good thing is that we not a good thing, let me put it this way, we do not have clinics. So your first contact with a health practitioner, normally it's a doctor or a paramedic in case of emergency. So I would advise you to, as soon as you arrive in Germany, to find yourself a general practitioner, because we do not have clinics where you don't need an appointment, you just go straight. But in Germany you have to call and look for an appointment before you go to the doctor. All right, so yeah, that's one major difference. That's why we do not prescribe medications, because we do not work in clinics, but also in the hospital. If my patient is maybe having a headache or high blood pressure, I have to call the doctor and inform the doctor, and then the doctor can tell me what I can give. Although you have learned, you know what to give, you need a doctor's prescription, either written or oral. Yeah. Again, now, oh my goodness, what did I want to say? What did I want to say? Yeah, and yeah, we do a lot of things also using computers. Like, we the nurses are the ones to order patients' food. Not really order, but when the patient comes, I ask their diet and if they have allergies for food and whatnot, and then I put it in the system, and the kitchen will get that. And yeah, we have service ladies, like we call them service craft. That lady works in the kitchen and she'll be the one to give the patients food, but she cannot feed them. I am the nurse supposed to do that, but she can prepare the food for the patient, put it on their table, and then call the nurse, like, the food is ready, maybe you can go help the patient to eat and all that. Yeah, so we do not have enrolled nurses. The nurse does everything. and students, they usually get allocated a praxis anleiter, so a person that did further training to show them correctly what to do and that. But they can work with every nurse, but they must have a praxis anleiter, and that nurse will be the one to have the teacher usually come to the station, and then the teacher will be talking with the praxis anleiter and be talking, how is the student progressing, do we need, how can we help the student, and all those things. So they're the ones to sign books. I've never really seen a book, but I've seen a file where there's a lot of things. Yeah, so you cannot sign here. You know, I was always excited. You know, when I was studying, I was like, some nurses who have to fight in Namibia to get a signature. I was like, I don't want to be that nurse. Maybe when I will be working as an RN, I don't know. I was thinking, my attitude, maybe I'll be like, hey, you bring your book here. No, I will not sign today. You know, the attitude we were getting from nurse. So I was always like curious, what kind of nurse will I turn out to be when I'm working with students. But here, you cannot sign books, but you can work with them, teach them more, this and that. But there they have praxis anleiter, and the teacher usually maybe comes once in a week or twice, or once in 2 weeks, just to check how they are progressing. Genau. Oh my goodness, I think I have covered what I wanted to cover, and if I remember anything, I will come back again with part 2. But do consider subscribing, comment, and then share the content. All right, but overall I'm enjoying my job in Germany, because number one, the patients, like, some patients can be difficult, but so many patients are so grateful. Like, they give me motivation to wake up and go to work, like 100%. They'll be like, oh, thank you so much for your help. A lot of them are actually very grateful, and that is a motivation to me. And I love my colleagues. A lot of them are actually so kind, and I'm always so happy to work with them. And I'm learning a lot in terms of diagnosis and medications treatment, because I believe, like, the doctors where I'm working with, they are very good with diagnosis. They will connect dots just to see, okay, what is this person having. They are good with diagnosis. And I'm also learning a lot with medications, because there's diverse medications. Like, I'm learning a lot. There's no deficiency, so to say, in medication. So sometimes I'm like, this disease, how do we treat it at home, or what, and then what do they give here, and all those things. And that a lot of doctors, I can always ask and say, okay, how do you treat this and that. So yeah, so that's why I'm enjoying my job here in Germany. And the number 3 reason is the holiday. I'm here, first of all, because I also want to travel and see the world, and 8 weeks of holiday kind of affords me to do that. And the other thing is that that I may be working 8 days, and 6 days I'm off. So yeah, for me, those are all advantages I took in mind before I made the decision to move abroad. Although I didn't know all these things, I got to know these things here. But yeah, so far so good. Yeah, so far so good. So yeah, I just wanted to give you an overview so you know what to expect before you come to Germany. Yeah, but yeah, I'm signing out. Thank you so much. Do consider subscribing, commenting, and leaving a comment. Aye guys, English never loved us. But anyways, share the content and do consider subscribing. Thank you so much for stopping by. Adios.